And I am excited to welcome Sheena Helgenberger. She is the director of Live Well Omaha Kids. So with that active applause, if you all stand up and help me welcome Sheena.
Thanks, everyone, and thank you for staying for the final session. Feel free to stand up as you need, because if you're like me, I start to get sleepy around this time. So I'm here to tell you about some of the lessons from the community collaborations we've had at Live Well Omaha Kids, mainly the lessons from the last 3 years. So we were started in 2006, and for the majority of our life as a coalition, we were under a specific health system. In 2014, they gave that coalition to a nonprofit called Live Well Omaha so that it could be more of a neutral convener and get some of the competing hospitals to the table. So I have been the director since then. This is just a little snapshot of the healthy weight issue that we're dealing with in Douglas County, which is the county in Omaha. We have 1 in 4 kids that are overweight or obese. And according to the Community Health Needs Assessment, obesity, nutrition, and exercise is the perceived #1 issue for children when surveyed parents. And this Community Health Needs Assessment is done in collaboration with all 5 hospital systems, the health department, and Live Well Omaha. So we are doing this every 3 years, much like all the other hospitals do across the nation. I will be touching on the different levels that we try to approach our work with. I would say the majority of what we're doing is organizational and community and policy, and trying to become better at those and more effective for sure. We also refer to the health impact pyramid, which I'm sure you're all familiar with. And the social determinants of health is really that main lens that we look at things, and trying to get more of our partners and businesses to think about that. So the factors of health theme fits right into what we're talking about in our day-to-day work. So one of the first projects, long-term projects that I've been a part of is our resident engagement efforts. We had some strategic planning sessions with our steering committee, which is kind of like our board of directors, but not quite that much power. They said 2 things as a group. We're the top leaders of a lot of the health fields, so yes, we bring a lot of expertise and experience to the table, but we also need to do a better job of involving the people we're trying to serve in the process. And so they thought Live Well Omaha Kids was a great way to sort of pilot some things we wanted to test out. So we also decided to take a place-based approach, going into a couple of specific zip codes and then sort of narrowing our efforts within neighborhoods in those 2 zip codes. So the way that we chose the first 2 areas that we would start our conversations and work in was through creating a layered map. And this is just a snapshot of the map that we have on our website. But we took data from our community health needs assessment on percentage of overweight and obese children, on top of poverty rates from the American Community Survey, and then also from the Community Health Needs Assessment, we looked at high perceptions of neighborhoods being slightly or not at all safe, according to the adults surveyed. So that helped us make a choice of maybe some high need areas, but at the same time, we wanted to know what the assets were. And so we did sort of an analysis of current programs that are targeting nutrition and physical activity with children. And so we picked 2 zip codes that have high need, but also high amount of champions, because we thought there's already sort of a network we can start tapping into that can help us frame the work that we're going to do together. So we have already begun that, but before we even talked to the first resident, when we were designing the project, we started with just conversations with some of the gatekeepers in the community, the trusted service providers and organizations. And so Charles Drew Health Center is one of those. Also One World Community Health Center, which has a high Latino population that they serve, and the Empowerment Network, which looks at addressing racial inequities and also sort of creating that sense of community in response to violence. So they all were part of the design team. We also had a work group looking at the facilitation guide. So they're helping us frame questions so that we're not going in saying, child obesity is a problem, how do we solve it? But more open-ended, sort of informal ways to get residents to open up about their day-to-day lives. And then we ran those designs and guides by other community leaders who often work with parents and families to make sure that we weren't saying anything offensive. That was really a big goal of ours, was just to make sure that we could learn from this and not offend and really co-create. So our first 2 focus groups were with service providers in those areas. So that asset list, we drew on that, invited them to the table, and got input from them on how we could best recruit adults to participate in the focus group study. And then from there, we ended up having an additional 4 focus groups talking to adults. And then we luckily had funds to hire a professional to record, transcribe, and analyze the data so that we didn't get held up for too long on that part. So the first phase is done. And however, in order to get the adults to show up, we wanted to make sure that we were respecting their time, because I get paid to be there and they don't. So we provided dinner for everyone. We offered childcare, which we found community volunteers to hang out with the kids while the parents were meeting in another room. And then we chose facilitators who are connected to the parts of the community that we were in. So one example would be, we had someone who spoke Spanish so that we could offer translation services, and someone who's an activist just around safe families facilitated the others. And then everyone participating got a $20 gift card to stay for the entire meeting. So they're essentially getting paid about $10 an hour. So that was important to us, and we were very lucky that we had funding to do that. Some of the initial findings are probably not a surprise to any of you, but the adults talked about safety is a huge need, and then peer support. And if they have those things, they can maybe start to think about what it is to be a healthy family, but those are some of the basic obstacles: a lack of safety and not really having other people that they know outside of their family that are going through similar experiences. And they also talked about the reliance on fast food and convenience stores with unhealthy options, and knowing that they're not consuming healthy foods, but feeling like with their busy lives, hectic lives, limited transportation, that they were doing the best they could. The next step is that we held a second conversation where we invited everyone back that chose to stay involved. We shared the findings, and then we asked them to sort of brainstorm what they would need in order to address some of the issues that they shared, and to identify how they'd like to be involved. Because ideally, we'll create responses that are both the public health people and other sectors, but then the neighbors themselves. And so we are just analyzing that information now. And one thing we're trying to do as well is share the project and the results and be transparent, so that other groups in the community could think about if this is helpful to their efforts to engage better with the community, or if they have feedback and how we can improve. Another area I mentioned is policy. We are involved in policy and have been for quite a while, but when we surveyed the child health and education groups that come to our coalition meetings, they talked about how they were comfortable with advocacy, but not confident in their skill set, and they didn't feel like they talked to anyone outside of their organization about ways to take action when needed, to talk to legislators or city council, or even school board members, for example. So we are working to better educate and mobilize our partners around policy issues that we all agree are important to achieving healthy kids. And I would say we're in the beginning stages of that, helping others do it well. And creating action alerts. We hosted a legislative breakfast at our state capitol around that gap in free and reduced lunch price and how some families don't even have that extra 30 cents. And while the bill that was created did not progress, I think we did a good job of just talking about sort of all of those issues that a child walks into the classroom with and how healthy environments and full bellies contribute to those academic outcomes that our school systems are really tasked with showing. We also are working specifically in the schools and have been doing that for quite a while. And we have about 3 levels of audiences or populations that we work with. The first is our service level providers, which were the ones that identified that need to get more confident in advocacy. I would say for us, the most challenging level is the school building level. And I'm sure you can commiserate, but as an educator, there are so many things you're doing during the day. We were trying to get a principal to complete the school health index, for example, and she said, well, I have to go cover recess and then relieve this other teacher who's sick, and then I'll try and get that done later. So, recognizing that they are superhuman at times and are trying to work with us and collaborate with us, but how can we sort of better hold their hand, and I mean that with a positive intention, so that they can give us the feedback we need, but then we can help them sort of analyze what that means for them and how they can achieve those outcomes they're trying to get by looking at school wellness. We're also, new for us, sitting down individually with school board members to tell them about the work that's being done around healthy learning environments, what we know through research, and what could be accomplished in their school district if they would be open to additional support and analysis of current practices in place. One of the current projects then that have stemmed from those conversations is updating their school wellness policy and sort of submitting a mock-up of what it could be using their WellSat analysis and also Alliance for Healthier Generations model policy. And so they're interested in that because in a particular school district we're working with, it's the policy committee on the school board that would make those changes. And we are also working at the ground level with the educators and principals, so we kind of have both of those approaches going on in hopes that we can make some improvements. We also conducted some PE research in that same school district, and we brought that result to the school board members to kind of show them just a snapshot. But we were in 6 third-grade classrooms. We used SOFIT and to monitor the intensity of the PE courses, but then how often, how many minutes those particular classes were getting PE. And this was kind of, I would say, a huge victory that this particular school district let us in to do research. They're very, and rightly so, hesitant to let outsiders potentially do research that could show negative sides of what they're trying to do. They have so many students and a lot of different high-need populations that they serve. And what we determined was that these classes had an average of 62.5 minutes of PE a week, and we know that Shape America recommends 150 minutes per week in elementary schools, and these classes were only meeting about once a week, so PE 1 day a week. And why this was sort of huge for us to do also is that as a state, Nebraska has no idea how often children in public schools have PE or recess, and there's no minute standards around that. So it's sort of a first step into maybe making some of those policy changes. Safe routes to school has been touched on already, but I'll just share that we got a generous grant from our local children's hospital to do this. And one of the amazing experiences that have stemmed from that is they created a learning collaborative of all of the grantees. So we all are doing some sort of evidence-based policy and environmental change in different settings. And we come together quarterly with different topics, and we have experts teaching us and giving us technical support. So things around implementation, evaluation, sustainability, reporting, and communication. Because typically the people delivering the grants and writing the grants aren't always trained in a lot of those practices. So this has been a huge win for us to get the money, but also to get the really hands-on support to do it. Also, I think Safe Routes is amazing because of that opportunity to partner not only in the schools, but in the community. So we've engaged with 12 organizations and 100 community members just in the 3 initial schools we've been working in. That include the Children's Hospital, City Planning, Public Works, neighborhood associations, neighborhood alliances, which are sort of the parent that gathers all of the associations in their area of town, our transit authority, the police department, the mayor, and also business owners, in addition to the school's parents and families. So I think for us, it's been kind of a cool step 1 to addressing some school wellness issues by saying we're gonna have a walk audit. They don't really know what they're signing up for, but in the end, the impact is maybe beyond what they could have imagined. So our timeline for this has been modified quite a few times to make space for that collaboration and relationship building. So originally we thought we'd just swoop in the fall, do those walk audits, but we started getting feedback from the city and the neighborhood associations that, you want us to be involved, right? Because we can write some of this into our city development plans. So, you really should be coming to the neighborhood meetings, which are, only once a month, and so you got to plan ahead and get them excited and on board, get the city on board, kind of research how this particular neighborhood is falling into city planning. So we ended up not doing those walk audits until that following March so that we could build those relationships. But it's been, I would say, well worth the wait so far because we are aligning strategies. There is, the transit group is doing block talks, which is just getting adults in specific neighborhoods to do a walk audit. But our school audits are complementing it, not taking away, it's adding to the conversation, kind of thinking about different perspectives of accessibility and safety and physical activity. So we are creating a shared reporting process so that when the city is looking at redevelopment or city improvements, they can refer back to all of this data from real people and the real suggestions that we concluded, and using that to move forward. As mentioned by a couple other people, staffing changes is definitely an obstacle. We've had a new principal at one school, and now we're getting 2 new principals at the other 2 schools, like halfway through the process. So we have to kind of pause and onboard and get them to understand and show them all the support we're bringing to the table, and so they don't feel too overwhelmed by the process that they're already walking into. Our district level contact even changed. So I think for us, just remembering that they're our customer and our job is to get this great work done, but sometimes you have to pause and step back and give them space to handle other crises. So that's just a part of the game, and luckily our funder is understanding of that. Just a couple of wins to talk about. So our walk audit reporting was just available in May, and so since then we've had a couple of things already promised and changed to us. So we were able to get a very busy intersection that has traffic coming from the suburbs to downtown and back for sporting events and shopping and entertainment, to extend the crossing time in the after-school hours so that the children could cross from school to those carpools and walking home into the after-school facilities. And then all of the schools are getting new crosswalk paint before August. They were originally in the next plan for 1 to 3 years, but we shared all of our data and they said, okay, we'll get it ready before school starts. So that's been really exciting to see that and to make sure that we tell all of the people that have been working alongside us how this is a result of the work that we're doing together. How am I doing on time? Okay, so I'll just go through here just to make sure. Okay, so one of the things we're really trying to put time into is sharing the awesome stories and even the not so great stories with our partners and community members and funders. And making sure we document it well so that we can use this when we do reporting, when we're asking funders to invest in further projects. So just not being afraid to capture those wins and give real-time updates. So it's not, this happened a year ago, way to go. But I think when we've been shouting this stuff out to our supporters and highlighting those outstanding partners, it sort of keeps them interested and feeling like, okay, we're actually getting something done. So however small it is, taking that time. And we're lucky that we have someone on staff that does communication and design work. So I write all the content. She edits it and tweaks it and makes it look pretty. But I would say for us, as a small nonprofit of only 4 people, this has been probably one of our greatest things that we've focused on this year. So thank you.